In this podcast, two researchers from dot.rural discuss the healthcare research project entitled MIME and explain the principles and research behind it.
And the aim is really to support emergency response in remote and rural areas. If you think about remote and rural areas of Scotland, they're really quite geographically isolated, and it can take a long time to actually reach someone who's in difficulty, for example, from a road traffic accident or whatever. So, we're looking to support the people on the ground in the community, and that could be a community first responder, basically someone who has very basic expertise. It could be a GP, a nurse perhaps, and then the paramedics will arrive later. So we're trying to design technology, looking at novel hardware, novel software, to really support them in their role whilst they're waiting for more sophisticated expertise to arrive.
So what sort of technology?
It could be something like a mobile phone or a smartphone. It could be maybe a little bit larger, like an iPad, for example, like a kind of a tablet PC. The main thing we have to do is to go out and speak to potential users and say, we've basically got two different kind of strands in our research team. We've got remote and rural health researchers, which is kind of what I'm like, and then we've got our computing scientists, because it's important that we're multidisciplinary and we understand the environment, but then we have the expertise to develop the software and to develop the hardware. So that's really the kind of split we have. We also want to try and interact with the people who are manufacturing novel health monitors, so that we have both academia and we have industry as well. Okay, in terms of the hardware, we're looking at using really light adhesive patches effectively. I mean, it's maybe not as small as an elastoplast, but it's something that is really simple to just apply on the chest. It sticks really well, even with chest hair, really nice and lightweight, less than 100 grams. And it just has to be very easy for the person to apply onto the chest, because they might not have very much training. You want to, maximise the number of people that can use the system. So that's with the hardware. I think possibly one of the more clever bits is going to come in the software, because we're trying to support the person in what they're doing. So we're going to maybe try and include decision support. So you might say, maybe the person's airway is occluded, check airway, apply oxygen, that kind of thing. So you're supporting the person in the role, and it can be a very high workload situation as well. So you could have one casualty here, another casualty there, and it could be very difficult to get around them all. So if you had a monitor in each person, then you could say, okay, this person needs me more than the other one does, and then you can go and direct your medical expertise to them. Okay, we're focusing on road traffic collisions at the moment, primarily because remote and rural areas actually have more road traffic collisions than urban areas do, and because the geography, it can take a long time to get there. So that's one thing that we're focusing on. But really, it could be used for just remote and rural community use. For example, someone has a heart condition, perhaps asthma. There's a number of conditions that this kind of device could actually be useful for. It's really supporting them and kind of working with them, so that when they arrive in a scene of an accident or at a casualty, they have better kind of situational awareness. Because if you imagine, if you're trying to go down and take a pulse, you're maybe not going to have a bit of paper that you're going to write it down on. You're just going to go in, take the pulse, register it in your brain, and say, okay, that's lower, that's high, that's okay, and then kind of move on to the next one. However, if you had a bit of technology that's building up this information, it's taking that pulse automatically, you don't have to do it. It's taking your respiratory rate, again, you don't have to do that. So you're building up a real trend of information, so that when another person arrives on scene, you can say, okay, this is what's happened to the person, show them a summary of their health over the past half an hour or whatever, and then that can be handed over to the paramedics as well. So we're trying to maintain and preserve a better flow of digital information, because at the moment it's really just pen and paper. So we could really improve on that in rural areas. So we've had talks with the Scottish Ambulance Service, Basic Scotland, which is the British Association for Immediate Care. They provide pre-hospital training for GPs and nurses. We want to go out and speak to first responders. We want to go and speak to GPs, nurses, a whole variety of people, so that we can just get a feel for what they want. And as I said before, it's really important for it to be grounded in what people are doing at the moment. But okay, we are looking into the future, to try and be really novel, but we have to be realistic as well.
Right, okay, so
from the hardware point of view, we are working with the industry to develop new sensor, new tablet, so new mobile computers. From a software point of view, we will use natural language generation system. We're going to have to develop new user interface and a new decision support system.
okay, so
Generation is a natural language processing task in which a computer system is used to generate a text in either English or any other language of your choice, based on a non-linguistic representation of information. So what natural language generation system does is that it will translate the complicated data into something that easily understandable for the parent.
what the user's going to use.
I'm glad that you asked. Actually, the user interface part is actually a great challenge in the MIME project. We have to consider the fact that the user has very little time to interact with the computer. The size of screen is also an issue because it has to be mobile, it has to be transferable. Again, it has to be big enough to display information so that the user can see it at a glance. Any information that display on the tablet or any hardware device that we're going to use should be comprehensible within, say, 10 seconds. Yeah. Shall we use text, sound? Now, each representation will have its own advantage and disadvantage. If you display any kind of information in a text format, the user won't be required to look at the screen, so he or she will be distracted. If you use sound, that can be avoided.
Work this out.
Well, I think at the core of the MIME project is a sensor system that enables the first responder to continuously monitor the patients at any time. Of course, in any condition, the sensor cannot get up to 100% accuracy. So when we deliver the information back to the first responder or to the doctor down the line, the uncertainty of the sensor will also be communicated, and that's something that we can capture and we will capture.
Possibly human error.
I think this is the main challenge of any natural language generation system, because at the core of the system, a natural language generation system interpret the data, as you said, and present the summarized information back to the user. So we our approach is we're going to work closely with the potential the user system. Community first responder, the ambulance crew, paramedics, people who are going to train the first responder to figure out exactly how we should communicate the data back to the users, and hopefully with the active participation of the users, we'll get it right.
Okay, so is there something else?
Well, natural language generation on its own is not a new technology, but when you try to develop a natural language generation system in any new domain, you will be met by new challenges. So mostly it will be how to sort of interpret a huge amount of data with a great amount of uncertainty as well, and how to communicate them into a wide range of users with different medical level, medical knowledge.
Well, the project's running for 3 years, so that will be up until 2012 at the moment, the end of 2012. Trying to do things as quickly as possible because we really want to get out there to try and deliver this impact.